I have, and I'd venture to guess many of my colleagues, if not all, have heard stories from distraught constituents about what is very appropriately named surprise billing, where they go for an emergency visit or often a scheduled planned medical procedure or surgery, which goes according to plan, and then receives a surprise bill, often in the tens of thousands of dollars. So, Ms. Schuman, let's walk through a scenario, please. And I've heard from individuals who have experienced similar scenarios firsthand. At the advice of a doctor, an individual schedules a surgery and confirms that the hospital is in network. The surgery is scheduled 8 weeks in advance, and the individual assumes that there will be no issues with undergoing surgery in an in-network hospital. Only after the surgery does the individual learn that the surgeon was out of network, the primary surgeon, mind you, and receives a bill for $25,000. Had the individual known the surgeon was out of network, they would have very likely found an in-network surgeon. Doesn't that sound reasonable?
Absolutely.
Okay.
And I think that exactly the situation when the patient is doing their homework, they're doing their research. How are they to expect that some of those other services would be out of network?
Okay. Well, what would the patient, what do you recommend that the patient do differently? Ask further questions?
Well, I think in this kind of situation, the patient did everything that they could be doing. And the problem is not the patient. The problem is not the consumer. The problem is that the consumer didn't have knowledge and didn't have a choice. And again, in some situations, even when they have knowledge up front and they are informed of that, they still may not have choices. So I think it's knowledge and choice that the consumer needs.
Well, choice would be understandable. Mm-hmm. Knowledge, not so much. What about the hospital? Do you feel they had any responsibility here in this scenario?
Absolutely. Hospitals play a critical role in this. When you go to a hospital, again, they have the leverage, they have the ability to negotiate with those physicians that are practicing in their hospital. Getting back to something from my testimony, it stands to reason that when you contract with a hospital, all of those essential services that are performed in the hospital under that roof, like anesthesiology or radiologists, would be in network. How can you go to a hospital, how can you have surgery without anesthesiology, or a hospital operate without radiologists?
So you also feel the surgeon in that scenario would have responsibility, or would it be the hospital?
Absolutely. And I think getting back to this point, everyone has a stake in this. All of the stakeholders have a role to play.
Okay. So what would you offer that could be done during that 8-week period leading up to the surgery to help assure that the patient would not receive a surprise bill?
Well, I think we have to look at this in a comprehensive way. And I think, again, we talked about transparency, upfront disclosure. So at the time of scheduling, not when they get into the surgery room, to be able to make a decision based upon their action. But even that alone is not enough. And I think what we have to talk about is getting behind the reason why the patients might have a meaningful choice or might not even know. And that's why I think a federal standard, a federal solution that does not discourage these out-of-network specialists to stay out of network and generate these surprise bills in the first place is the core of the solution.
Okay, thank you. Madam Chair, I yield back